Hey everyone, welcome back for another deep dive with us. Today we're going to be looking into something pretty interesting. It's called acromegaly.
Yeah, it's a fascinating one.
Yeah, and maybe you've heard of it, maybe not.
Maybe not.
But essentially what it is it's a hormonal disorder where the body produces too much growth hormone.
Right.
And we've got a ton of material on this. And our mission today is to really break it down.
Absolutely.
We want to help you understand what causes it, what it does to the body, and how it's treated.
Yeah.
And we want to make this clear and insightful for you without getting too bogged down.
Right. And I think one of the things that is fascinating about this is how descriptive the name is.
Oh, yeah?
I mean, acromegaly, it comes from Greek.
Okay.
Acrom means extremities, like your hands and feet.
Right.
And megaly means enlargement. So right there in the name, you have a clue.
Yeah, that's a big clue
Yeah.
about some of the changes involved. And actually, that's a good place to start. What is acromegaly? I mean, we said too much growth hormone, but what does that actually mean for
Yeah.
someone?
So at its core, it really is about excessive growth hormone, and that's usually from a non-cancerous tumor in the pituitary gland. So you've got this little gland in your brains, like the master control for hormones, and a benign growth there called an adenoma is usually the culprit.
Okay.
Now, it's really important to make a distinction here between acromegaly and gigantism,
Right.
because they both involve growth hormone.
Right. Too much growth hormone.
Right, but gigantism starts in childhood before the growth plates in the bones have fused.
Oh? Nice.
So acromegaly usually shows up in adulthood, usually between 30 and 50.
Wow.
And that timing difference is why you see different physical changes.
Okay, so we've got these pituitary adenomas,
Right.
which we know can come in different sizes, right?
Yeah.
What's the difference between those different sizes?
Yeah, so there are macroadenomas, which are bigger than 10 millimeters. And because they're bigger, they can actually press on things nearby. And that's why sometimes people with acromegaly can have vision problems because it might be pressing on the optic nerves.
Oh, wow. So it's like a space issue almost in the brain.
Exactly. Yeah, it's taking up space and it can push on those important nerves that connect your eyes to your brain.
Wow.
And then you have microadenomas, which are less than 10 millimeters.
Right.
And they might not cause that same kind of pressure, but they can still pump out a lot of growth hormone.
Oh, wow. Okay.
And I think it's worth mentioning there are some other less common causes of acromegaly, like tumors in other parts of the body that start producing growth hormone.
Oh, really?
Yeah, like in the lungs or pancreas, and that's called ectopic GH secretion.
Okay.
And then there's something called GHRH excess.
Geez.
Yeah, growth hormone releasing hormone. And basically, there might be a tumor, maybe in the hypothalamus, which is part of the brain,
Oh.
or somewhere else, that's making the pituitary gland release too much growth hormone.
I see, but that's not as common.
No, not as common as the pituitary adenoma itself.
Okay, so we've got all this extra growth hormone in the system, but what's actually happening? What's causing these changes we see with acromegaly?
So the excess growth hormone doesn't directly cause the bone and tissue growth, but it signals the liver to produce another hormone called IGF-1.
IGF-1?
Yes, insulin-like growth factor 1. And you can think of IGF-1 as the actual growth engine.
Oh, okay.
It's the elevated levels of IGF-1 that are really driving that abnormal growth in bones, cartilage, and other tissues.
I see.
And beyond that, there are also metabolic effects. Chronic exposure to high levels of GH and IGF-1 can lead to insulin resistance,
Oh, wow.
which we know can lead to diabetes.
Right.
And it also increases the risk of high blood pressure and heart disease.
So it's not just about how you look, it's about your whole health.
Exactly. Acromegaly is a systemic condition.
So let's talk about those physical changes, because I imagine they can be pretty noticeable.
Yeah, and they're often what brings people to the doctor, although because it can be gradual, it might take a while to see the pattern.
Right, it's not like you wake up one morning and you're totally different.
Exactly.
Yeah, okay, so what are we talking about here? What kind of changes are we seeing?
Well, remember the name extremities and enlargement. Facial features can change. The nose and lips might get thicker. The tongue might enlarge.
Wow.
That's called macroglossia.
Acroglossia.
Yeah, it's a mouthful.
It is.
Your hands and feet might get bigger.
Oh, wow.
You might need bigger rings, bigger shoes, and that can be a real practical sign.
Yeah, I bet.
And then there's jaw protrusion, where the lower jaw juts forward.
Oh, wow.
That's called prognathism.
Prognathism.
Yeah, and that can lead to wider spaces between the teeth.
I see.
Your skin might also change, get thicker, oilier, and you might sweat more.
Oh, wow. So a lot of very visible changes.
Yes, and even your voice can deepen because the vocal cords and sinuses enlarge.
That's a lot to take in. And on top of that, we have those systemic complications you mentioned earlier.
Yeah, beyond what you can see, acromegaly can cause a whole range of problems.
Right.
The cardiovascular system is really vulnerable, so there's a higher risk of hypertension, cardiomyopathy.
Cardiomyopathy.
Yeah, that's a disease of the heart muscle,
Oh,
and that can lead to heart failure.
wow. Okay.
And then we've got the metabolic issues, the insulin resistance and diabetes,
Right.
and then high levels of fats in the blood.
Okay.
And then the musculoskeletal system is also affected, so more arthritis, carpal tunnel syndrome, and spinal stenosis.
So it's affecting everything.
Yeah, pretty much. Even breathing can be affected. Sleep apnea is common because the tissues in the airway can overgrow.
Wow.
And neurologically, you might get headaches. And if the tumor is big enough to press on the optic chiasm,
The what?
it's where the optic nerves cross.
Oh, right, right.
That can cause vision loss.
Oh, wow. Okay, so given all of that, how is acromegaly diagnosed? Seems like it could be tricky.
Yeah, it can be, especially because the onset is so gradual. But there are key tests.
Okay.
One of the most reliable is the IGF-1 level.
IGF-1?
Yes, remember we talked about that.
Right,
It's produced by the liver in response to growth hormone,
right, right.
and it's consistently elevated in acromegaly.
Okay.
So if that level is high, it's a strong sign.
Mhm.
And then there's the oral glucose tolerance test, the OGTT.
The OGTT?
Yeah.
Okay.
Basically, you drink a sugary solution, and normally growth hormone levels should drop significantly.
All right.
But in acromegaly, that doesn't happen.
Oh, so the growth hormone stays high.
Exactly. And if it doesn't suppress to below 1 nanogram per milliliter, that's a key indicator for doctors.
Okay. And what about imaging? Does that play a role?
Absolutely. An MRI of the pituitary gland is usually the first step.
Okay.
It gives a really detailed picture of the gland and can show the size and location of any tumor. If an MRI isn't possible, a CT scan can be done, but it's not quite as detailed.
I see. So once a diagnosis is made, what are the treatment options?
Well, it really depends on the individual, the
Yeah.
size of the tumor, their overall health, those sorts of things.
Right.
But often surgery is the first line of treatment,
Okay.
and the most common procedure is transsphenoidal surgery.
Trez what?
Transsphenoidal, it means they go through the nasal passages to remove the tumor.
Oh, wow. So they don't have to open the skull.
Exactly. It's much less invasive.
No. Okay.
Now, the success rate for this surgery really depends on the size of the adenoma.
Okay. How so?
Well, for microadenomas, the success rate in terms of getting hormone levels back to normal can be as high as 80 to 90%.
Wow, that's great.
It is, but for macrodenomas, it's a bit lower, maybe 40 to 60%.
Still pretty good, though.
It is, but like any surgery, there are risks.
Right, of course.
Things like diabetes insipidus, which affects fluid balance, or hyperpituitarism.
Hypopituitary.
Yeah, that's where the pituitary gland isn't producing enough other hormones.
I see. So if surgery isn't an option, or if it's not totally successful, what else can be done?
Well, there are medications that can help manage acromegaly.
Okay.
One common type is somatostatin analogs, or SSAs.
SSA.
Yeah, they mimic a hormone that naturally inhibits growth hormone.
Oh, yeah.
So they can suppress growth hormone levels in about 50 to 70% of patients.
That's good. Any downsides?
Well, they can cause side effects like gallstones and stomach problems.
Oh.
There's also dopamine agonists.
Okay.
They're not quite as effective, but can be helpful in mild cases.
Okay.
Or if the tumor is also producing prolactin.
Right.
And then there's a drug called pegvisomant.
Pegvisomant.
Yeah, it's a GH receptor antagonist, meaning it blocks the action of growth hormone.
Oh, so it's working on a different level.
Exactly. It reduces IGF-1 levels, and it's often used when other medications haven't been enough.
Okay, so we've got surgery, we've got medications. What about radiation?
Yeah, radiation therapy is usually reserved for cases where surgery and medications haven't been enough to control the hormone levels.
Okay.
There are different types, conventional radiotherapy and gamma knife, which is a more targeted approach.
All right.
But radiation has its drawbacks. It can take years for the full effects to be seen.
Oh, wow.
And there's a risk of hypopituitarism because it can damage the normal pituitary tissue.
Okay, so what's the long-term outlook for someone diagnosed with acromegaly?
Well, the good news is that the prognosis has really improved with better diagnosis and treatment. But early diagnosis and treatment are key.
Right.
Because if it's not treated, it can lead to serious health problems.
Like what?
Heart disease, diabetes, and even a shorter lifespan.
Wow.
And even with treatment, there can be long-term complications.
Okay.
Cardiovascular disease is actually the leading cause of death in people with acromegaly.
Really?
Yeah.
Yeah.
And there's also an increased risk of colon polyps and colon cancer.
Wow, I wouldn't have thought of that.
Yeah, it's thought to be because of the effects of growth hormone and IGF-1 on cell growth.
I see. So it's really important to catch it early.
Absolutely.
Now, are there any other conditions that might look like acromegaly?
Yes, there are a few things doctors would consider.
Um,
We've already talked about gigantism, but that's in childhood.
right.
And then there's pachydermoperistosis, which is a rare genetic disorder that can cause similar symptoms, but it has other features too.
Okay.
And severe hypothyroidism can sometimes cause facial changes, but the hormones involved are different.
Okay, so to wrap this up, what are the key things for people to remember about acromegaly?
Well, it's a chronic progressive hormonal disorder,
Okay.
most often caused by a pituitary tumor,
Right.
and it needs a team approach to manage it.
Okay.
But the most important thing is early diagnosis.
Right.
That's crucial to prevent complications.
I see.
And although it's rare, the good news is that treatments have really improved the lives of people with acromegaly.
Well, that's good to hear. So for those of you listening, I hope this has given you a good understanding of acromegaly.
Yeah.